Diabetes is the ninth leading cause of death among women globally, causing about 2.1 deaths annually. Today on Sound Health, we will find out how to reduce the prevalence rate among women. I'm Olasumbo. Welcome to the show. Thanks for staying with us. It's still Sound Health on Lagos Television, and today we are looking at how to reduce the prevalence rate of diabetes in the country. And I have with me Professor Olufemi Fasomade, a consultant endocrinologist with the Lagos University Teaching Hospital. Welcome to Sound Health.
Thank you for having me on your program. I'm pleased to be here with you.
According to the International Diabetes Forum, diabetes is the ninth leading cause of death in women. Is it a life-threatening disease?
Diabetes mellitus is a life-threatening condition, especially when it is undiagnosed in time or when it is diagnosed and poorly treated. It leads to many deaths worldwide.
Okay. What are the causes and types of diabetes? Are there types?
Diabetes mellitus is a non-communicable disease, and there are two major types. The first one is type 1 diabetes, which is the one that is seen in much younger people, sometimes people as young as 1 or 2 years old, and that is the one that is usually treated using insulin injections on a daily basis. And then the second type, which is commoner, which is type 2 diabetes. That one is seen usually in older people. So if you see diabetes in adults, especially in the middle age, most likely it is a type 2 diabetes. Some of these ones can be treated with tablets alone, some of them with insulin, some of them with a combination of both, and some of them are even lucky. They're able to get treated just using diet and exercise.
Oftentimes, you hear people say, I am bound to have diabetes because my parents had the condition. Is it hereditary?
Diabetes does not have one single cause. Diabetes has several predisposing factors. And there are two major categories of these predisposing factors. One of them is what we call environmental factors. That is things in our environment, in our community, in our society. And then there are the other ones that are genetic, meaning what we do inherit from our parents. So if a person tells you that, yes, I think I had diabetes because my parents had diabetes, that person is partially correct, because having parents with diabetes puts a higher risk on the offspring for developing the same condition.
Is it true up to 70% of cases of type 2 diabetes could be prevented through adopting healthy lifestyle?
Yes. Just several decades ago, diabetes was a condition that was largely unknown to man. And the reason for this is because just some decades ago, people did a lot of physical activity, a lot of walking around, a lot of consumption of adequate fiber, and people didn't get obese. But as you look at the changing times, people are getting heavier, people are doing less exercise, people are eating more, people are taking a lot of carbonated soft drinks, people are taking a lot of alcohol, a lot of smoking. All these things predispose to having diabetes. So if you could just live a healthy lifestyle, you can prevent diabetes mellitus.
Looking around now, we have increased cases of this condition among children. What could be the cause of this?
Diabetes is becoming commoner in children because nowadays our children are getting heavier. Children are getting more and more obese. Nobody is very sure why this is so, but it could be the fact that nowadays many families are having less number of children. So before, a family had 6 children, 8 children. Now some families are content with just 1 child or 2 children, and they pamper these children. They don't allow them to go out to play. They don't allow them to exercise. They take them to school in the morning. From school, they go to lesson in the afternoon. From lesson, where they're learning extra lessons from other teachers, the next thing they go for music class. So these children virtually are kept indoors from morning to night without much physical activities.
Okay.
And to worsen matters, some schools even now have fast food joints within the premises so that the child can have access to soft drinks, to meat pies, to all kinds of sausage rolls and sweets. So these things make the children bigger, and when you are fatter, then you have a higher risk for developing diabetes, irrespective of your age.
Apart from increased cases of diabetes among children, we now have more increased cases among women. Currently, we have about 199 million women living with diabetes. This is projected to increase to about 313 million by 2040. How do we cut this rate?
Well, we got here due to changing lifestyle. Currently in the world, we have about 416 million people who have type 2, who have either type of diabetes, whether it's type 1 or type 2 or the one associated with pregnancy. And of these over 400 million people with diabetes, up to half are women. You wonder, how did we get here? Because it wasn't like this some decades ago. We got here because people changed their lifestyle. People decided to become more sedentary. People decided to eat much more than they needed. Some people take soft drinks with each meal. Some people take alcohol as a recreation. Not many people are involved in walking long distances for different reasons.
Talking about sedentary lifestyle, women hardly take care of their health. They do that at the expense of taking care of others. This year's theme is Women and Diabetes, Our Right to Healthy Future. How do we improve access to healthcare facilities for women?
Well, it is true that women are engaged in a lot of activity, but many of this activity, or a lot of this activity, is mental. They have to multitask. They have to think about what to do for this person, what to prepare for the children, what to prepare for the husband. But we find out that most of this activity sometimes is done within the confines of the home. So there's not much physical activity where the woman is loading clothes into the washing machine, or is getting her daughter or the house help to wash the clothes. She's arranging the food. She's making phone calls to the person to supply water or drinks or food. So not a lot of the activity going on in the home involves a lot of physical
movement.
Yes, movement. Usually it's movement within a small confine. When we talk of physical activity, we need the person to take at least like 10,000 steps every day, or to walk somewhere between 3 to 5 kilometers daily. But not many people will indulge in such activity. When you have taxis, you have tricycles, you have bikes that can take you, and then the women who are more affluent, their husbands will leave the car with the driver. Please take madam to wherever you want to go, and they go to the shopping mall. To even climb the stairs, there is an elevator that takes them up and down. So you don't have much movement, and for that reason you're not burning much energy. When you're not burning much energy, you put on weight easily.
Okay. Women with type 2 diabetes are almost 10 times likely to have coronary heart diseases compared to women without the condition, as well as women with type 1 disease are also bound to have miscarriages. Their children or child might have malformation during childbirth. How can you reduce this risk, and are there any health conditions associated with diabetes?
Diabetes is associated with many complications. Several of them affect the cardiovascular system, which you have rightly mentioned, meaning that the person with diabetes is prone to heart attacks, is prone to chest pain from angina, which is what usually leads on to the heart attack. They are prone to problems like heart failure, stroke. They also have other problems, kidney failure, or they could have sores in the leg that lead to amputation. For the pregnant woman, many uncontrolled diabetic pregnant women usually have poor outcome of their pregnancies. By a poor outcome, I mean either premature labor, miscarriage, abnormal babies, obstructed labor, stillbirths. All of these complications that occur in pregnancy, they are much commoner in the pregnant person who also has diabetes.
Okay.
So if you have a woman who has had 6 miscarriages, 7 miscarriages, one of the first things we look out for is she diabetic? Because if you have diabetes, the risk of these complications is more.
Okay, is there a cure for the condition?
Diabetes does not have any cure. What we do is we manage the condition. It's a chronic disease. We manage it. When you talk of cure, usually that is something that can be applied to communicable diseases. If a person has malaria, you can give him treatment and in 3 days the malaria is cured. If a person has an infection, you give antibiotics, in a week is cured. But diabetes is a condition that once discovered has to be treated lifelong. It has to be managed.
I'm talking about diet. I need you to focus more on, I know some people, they will tell you I can only eat beans, I can't eat carbohydrates and all that. Can you please focus more on the diet?
Well, when we are talking about diet with diabetes, the ideal person to give a diabetic a diet prescription is the nutritionist or the dietitian. So usually a physician, after seeing the person who has diabetes, will give a note, go and see your dietitian, go and see your nutritionist, and they will be able to look at the person's background. For instance, the diet of a Yoruba man is different from the diet of an Igbo man. It's different from the diet of a Fulani man or an Ibibio man. So the person will look at the background of the person in addition to the condition he has. For instance, a person may have diabetes and hypertension. That may adjust the diet prescription. But generally speaking, the type of diet that is good for the person with diabetes and is good for every other person is a diet that has plenty of fiber. Plenty of fiber. Fiber meaning your vegetables, meaning your cereals, meaning some of your nuts. So that is a good diet for the person with diabetes. And also is a diet that has limited oil. So soaking food in oil or frying, deep frying, all those are things that are not usually advocated. And then the carbohydrate should be a complex carbohydrate. Complex carbohydrate is things like your fufu, amala, semo, tuwo. Those are the type of things that they should take more than the simple refined carbohydrates. The simple refined carbohydrates, you find those ones inside bread, you find those ones inside sausage, roll, meat, roll, pie, you find those ones inside biscuits and cakes. Those are simple or refined carbohydrates. And the most simple and deadliest of the carbohydrates is the raw sugar that people put inside their tea or inside food, or glucose. Some people put glucose inside their ogi, plenty spoons. Some put sugar. They're all simple carbohydrates that are not good for the person with diabetes. And for the person who doesn't have diabetes, consuming large quantities also puts the person at risk.
Okay, doctor, what are your final thoughts on managing diabetes, especially among women and children?
Yes, my thoughts on managing diabetes in women and children is that education plays a major role. And someone said that if you educate a woman, you're educating a family or a nation. So if a woman who has diabetes is well educated, not only will she take care of herself, she will take care of her unborn children. And she will also take care of those who have already been born and her husband, because when you have diabetes, usually there are some lifestyle changes that we advocate. Eat healthy, do exercise, don't take alcohol, don't smoke, do some physical activity, take some long walks, sleep better, eat vegetables. All these things translate to an improved lifestyle, improved health, and improved longevity.
Thank you so much, doctor, for sharing your expertise with us on Sound Health.
You're always welcome.
That has been Professor Olufemi Fasonmade, a consultant endocrinologist with the Lagos University Teaching Hospital, on managing diabetes and reducing the prevalence rate in the country. Sound Health continues with trending and home essentials. Please stay with us. Thanks for standing by. It's still Sound Health on Lagos Television. Innovation this week is up next, but after weekly dose. Please stay with us.
diabetes drugs that reduce cardiovascular disease and death.
Adults with diabetes are 2 to 4 times more likely to have heart disease or a stroke than adults without diabetes. Half of all type 2 diabetes patients will die from complications from cardiovascular disease. Lowering blood sugar was the goal of newer diabetes drugs in the past 10 years. First attempts, however, still fell short from reducing scary statistics for these patients. 2016 progress shows that 2 medications are improving those statistics. The first, empagliflozin, yields significant reduction in non-fatal heart attack or stroke by 14%, and an injected medicine called liraglutide shows a marked reduction in major cardiovascular events. As 2017 will mark a complete shift in meds prescribed for diabetes patients, more patients will live to see the benefits.
That's Sound Health this week. Hope you've learned a few things about today's episode. For comments and inquiries, please send SMS on 0818-815-3695 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.